Welcome back. If you just joined us, we've been looking at Nigeria's health institution, the funding, and also the agreement between the federal government and some of the unions in the health sector. And our guest on this episode of Question Time is the Minister of State for Health, Dr. Osagie Ehanire.
As I said before, nearly all of these agreements predate this government, this regime. Some of them are difficult to understand. And when a regime comes in and starts to examine an agreement that you are supposed to agree to, accede to, because it was struck with the previous government, you pause a little bit. You want to study this agreement and see whether it's something you need to renegotiate. If, for example, you do not find that all the terms of it are actually up to date. Times have changed, conditions have changed, and if you decide that you would like to have a conversation all over again over certain issues or to modify certain areas, well, yes, it should be open. It should be open to that.
Tell us those agreements that you think are not justified.
Well, I can't give you all of them off the cuff right now, but there are some that are, whether justified is the right word, I do not know, but some are contentious. Like, for example, what they call skipping. If you have to enter a particular level or skip a particular grade level. Issues of call duty. Some people want to be on call to receive call duty allowance, even though they never do call duty. Some people want to receive teaching allowance, even though they're not teaching. So those are issues that need to be, and resources are scarce. You don't want to pay for services that you didn't demand or didn't request for or that was not rendered.
From your own perspective, when you look at the health sector as of today, what's your assessment?
The health sector is a work in the making. We are still working on it. We are trying to create an optimal health sector. We are trying to improve health delivery. We are trying to do the best we can with what we have. We have very good doctors, well trained. We have they have good skills. In some places we have up-to-date equipment, but there's a problem in places with commitment to work, which you want to find ways of addressing. There's a problem also with attitude to work, with the number of hours people spend at work. There are people who spend far less hours at work than they actually paid to spend. And then there are also issues of interpersonnel and interdepartmental rivalry, which need not be once relationships are clearly established and spelled out.
Now, many Nigerians are bemoaning the state of the health sector, especially the issue of medical tourism, which is not available to the common man. Recall that the president recently traveled for just an ordinary ear infection. How do you explain this?
Well, let me start with the ear infection. The president was examined by his physician. They checked out his ear. They checked out what needed to be checked out about it, and recommended that he needed to have some investigation that needed to be done to understand the issues into detail, which was not possible here, not available here. So he went out for that. Some people say he was flown out. He was not flown out. He flew out by himself to go and have this examination done, and it was done and clarified, and is back. Now, with the issue of health tourism, yes, we have a problem with that because we lose money that is estimated to be up to $1 billion. Some say in a month. That is a lot of money, which can be used to develop the health sector. But the problem with the health sector in Nigeria is the delivery of service itself. If you have gone to the hospital, yes, you'll be correct to say that the attitude of nurses, the attitude of doctors, the attitude of even those you see at the reception leaves a lot to be desired. I have always said that the doctors are good, they know their work. The nurses are good, they know their work. People are, they are well trained, and in many places they have equipment. But the service delivery is the Achilles heel. The service delivery it can be much improved. In the first place, punctuality to work, and then the total amount of work that is done, what you get done in the period of of being at work, and then the attitude to patients. That's what needs to be changed. And also,
are you
housekeeping. Housekeeping is something that needs to be improved, because the environment in the hospital needs to be made attractive. The surrounding, the landscaping, and the wards, the beds need to be made attractive. No matter how good the technical performance of the doctors and nurses are, if the environment does not meet the standard, people don't have the confidence to remain there for service.
You are indicting the Nigerian hospitals of poor sanitation and hygiene. Who is responsible to enforce this?
Well, I'm not actually indicting them. I'm saying areas where help is needed, where we need to improve. And we have been doing that. I have taken it upon myself to visit many government hospitals under our purview, and I have always raised that point, that they need to do a lot to improve the confidence that the public has in the hospital. They need to do a lot. They need to do a lot in landscaping. They need to do a lot in environmental sanitation. They need to do a lot in attitude to their patients, and in housekeeping. Particularly in the way they receive patients. I've always stressed that they should treat patients coming to the hospital the way they would treat visitors coming to their homes. Treat them with respect.
Now let's come to the issue of funding properly now. Many sectors are looking into concessioning. Would you consider the option of concessioning government institutions, government health institutions?
The efforts are on to improve healthcare. Concessioning is not what we are looking for at the moment. We are trying to improve service delivery and better attitude to patients, and more efficient use of resources, better management of material resources, better management of human resources, and better management of time.
Now let's come to the issue of disease control now. This is a point where the world is crying of the outbreak of Zika virus. What's the Nigerian government doing to address this issue?
Well, the Zika virus seems to have created a big scare around the world. Zika virus actually first appeared in Nigeria in 1954, where the first case was diagnosed. And since then, it has disappeared. This government is issuing advisory against traveling. But even when the Zika virus came in, it was here in 1954, we didn't observe this side effect of underdeveloped brains. We didn't. But it looks as if this is probably a different strain. It's not yet clear, but scientists are still looking at it. It's a different strain of a virus that also attacks the nervous system, particularly the brain. What we are doing now is issuing travel alert. If you are traveling to a country that has Zika virus prevalence, be careful. Make sure that you're not in a family way, as we put it in Nigeria, and make sure that if you are, then you have frequent checks, ultrasound check, to watch the development of the baby.
Before we wind down this conversation, the nation is in a state of technical recession. And what are you doing to cushion the health sector from these shocks?
In the Ministry of Health, we have long since developed a policy of do more with less. That is well known. We want to do more with less. We have reduced allocation, but we want to be able to do more by bringing in efficiency, by reducing overlapping, by reducing duplication, and by streamlining all the activities that the ministry engages in, and then dropping all those that are not of very great importance at this moment. So we're able to achieve more with less budget. We're making the best of the money that we get. We do hope for increased allocation during the next budget cycle, particularly the 1% consolidated revenue fund, which is earmarked for primary health care, and then also look forward to assistance from development partners from abroad who support us in all our activities in the healthcare delivery sector.
And that's it on this episode of Question Time. You may also send us your comments on our various social media platforms showing on your screen. Join us next week on another exciting episode of the show on Channels Television. Many thanks for watching. I'm Benga Ashiru saying goodbye.